pets, you probably use flea and tick medicine to keep them safe from bites and infections. But now there's a warning from the FDA that certain flea and tick medications can cause some serious problems for your pets. Some animals have suffered seizures. While the FDA says the medications are still considered safe, it's still sending this warning to pet owners and veterinarians. And veterinarian Mike Hutchinson says his office is being slammed with calls about the warning. Good morning, Dr. Mike. So what should we know about this?
So, when a new product comes out, and these products that we're talking about are Credelio, Simparica, Brevecto, and NexGard. They're all from the same molecule, basically, different synthesized versions. However, when these products came out about 3 years ago, we knew about these warnings because they were FDA-approved products with those warnings, that possible vomiting, possible neurologic side effects. We've been using them now 3.5 years, at least I have been in my practice. I've been using NexGard. And it's exactly what they said. And so now the FDA is started seizuring and you're giving NexGard, you might report that as a possible adverse event because that's the only thing you associate it to. Now that's not an autopsy or a necropsy, but still you should report it. And then the FDA has enough evidence to go back and say, yep, here's our warning. Enough people are reporting these side effects. Now we're aware of that, so I still use NexGard in my dogs. I still use it for my clients. I recommend it for them. But there are individuals that we would switch to a different product. If we see any kind of reaction to any product, we're going to switch them probably to another product if we think it's from that drug. So I think the warning is very responsible. The FDA has to report it, but it doesn't make me fear the products. They're incredibly safe, and flea and tick diseases are horrible. Last Saturday, there was a report in Los Angeles County, a typhus outbreak, which is spread by the flea to people.
Wow.
And it was front page news, a typhus outbreak, typhus fever. It's horrible. It comes from a flea. The first recommendation from the CDC, make sure your pets are getting flea products. Of course we do. Fleas and ticks carry horrible diseases that can transmit to people, and we want to keep that population down in our pets. If you suspect they're having a problem, certainly your veterinarian will help you pick the appropriate product for your pet.
So are we talking certain breeds of dogs that this may affect?
That's a great question. No, I think it's just certain conditions. You know, maybe an epileptic, we might want to switch to a topical product that's been out for 20 years that we know it hasn't been associated with seizures. And probably that's what we do. But for the most part, I'm not changing recommendations to my clients because the safety has been incredible over the last 3.5 years. I've talked to my colleagues and asked if they're seeing anything I'm not seeing. A lot of my colleagues, we're all saying the same thing. So if we were concerned, we'd be stopping it.
So you said NexGard, that's a product that I know. The other names that you used, are those generic names, or is that just the type of medication
they're different companies making similar products out of the molecule. You know, if one molecule comes out from the sea sponge, usually there's 10 synthesized products from it that are similar, but different companies, different makers. So Brevecto, Credelio, Simparica, and NexGard are all oral products that have been associated because they come from the same molecule. So they've been associated with this. Speak to your veterinarian if you're concerned about it. It's something that your vet is very, very well equipped to help you pick the appropriate product. We're not going to say stop it because that's horrible advice, in my strong opinion.
So seizures are obviously probably the most severe of the side effects, but what else could you see?
So vomiting, ataxia, which means drunkenness, wobbliness, things like that that could be associated with neurologic disorders. And that's what it does. It paralyzes the flea or the tick through the neurologic system. So it's only supposed to work in invertebrates, those animals without bones and backbones, but obviously it's transferring maybe in some small percentage of vertebrates or dogs. And
causing some issues in your pets. All right, well, thank you, Dr. Mike.
You're welcome.
So much for answering those questions, and stay with us. We're going to talk more with Dr. Mike ahead when he shares a few warnings about fall dangers for your pets.